I had degenerative arthritis in the hips, in both hips. 7 years ago I had another hip replacement, and this right hip has just slowly gotten worse. I procrastinated as long as I could because I just didn't want to have the surgery because I don't like to be down. I like to keep the workouts going. And gradually the hip started throbbing. It would throb throughout the day, and then the worst part is the sleeping. I would rotate with a pillow between the legs and just flip-flop about every 30 minutes throughout the night. Doing the research, I started out on the internet. I had another doctor. I did the left hip 7 years ago, which is a partial hip replacement. It's still a big procedure, and they do a lot of muscle cutting. And where I started to realize that there was newer technology out there available where they do less invasive, and so they go through the front of the hip. And that's kind of how I found Dr. Holman. He's one of the few doctors that do that procedure.
When it comes to hip replacements, the minimally invasive muscle sparing anterior hip replacement approach has proven or has demonstrated a pretty substantial reduction in pain with people after having their hips replaced. And that has really facilitated, again, the rapid recovery and the early discharge from the hospital. It's a muscle sparing approach where you don't cut any muscles, you put the hip in between the muscles in the front of the hip, as opposed to some of the alternative approaches which require fairly extensive dissection of the muscles. So people tend to be very, very comfortable really quite quickly.
I try to work out every day, Monday through Fridays, and on the weekends I usually just take one day off. I start out with the bike. And I'm graduating back to doing 200 floors a day on the stairs, but after the surgery, taking a little bit of time on the bike and slowly getting my way back up. I feel like I'm 95 to 100% right now, and it's only been 3 months.
But generally I tell people they're usually pretty good by about 4 to 6 weeks and pretty well back to normal activities by that time. They make the bulk of their recovery in the first 3 months after a joint replacement, and they continue to make improvements for a year and a half after the operation. So it's an ongoing process.
If someone's considering joint replacement, I highly recommend it. I know it's a big decision. It's definitely, when you think about replacing a hip, it's a big decision. Best decision I ever made. I feel great every morning I get up. There's not the throbbing, so I've got more sleep. I just feel healthier all the way around. The hospital experience, it was not what I expected. I mean, it was just, they made it easy, everybody's friendly. I just felt comfortable. Through the time that the surgery prep, until after the surgery, waking up, ordering dinner. Overall, great experience.